Hey guys, I did my trauma presentation on blast injuries. So let's get started here. The objectives for this presentation is that at the completion of this PowerPoint presentation, the students should be able to use their own words to describe what blast injuries are, identify the 4 different mechanisms people are injured by in explosions, in their own words, describe the tissues at risk during an explosion, know the golden principles of pre-hospital trauma care, and know what kind of assessment to do on a blast injury patient. When you think of blast injuries, people mostly associate it with military conflict, but it also can be seen in other settings such as industrial settings, in shipyards, mines, chemical plants, also more commonly known today with terrorism, still war, and then meth lab explosions. The 4 different mechanisms of blast injuries that we're going to talk about today are the primary blast injury, secondary blast injuries, the tertiary blast injuries, and the miscellaneous blast injuries. So to get started here, we are going to first talk about the primary blast injury. And primary blast injury are injuries that are due entirely to the blast itself, that it damages to the body. It's mostly caused by the pressure wave generated by the explosion when the victim is close to the blast. The blast wave causes disruption to the major blood vessels and rupture of the major organs. The injury from the primary blast is seen almost exclusively in the hollow organs of your body, like your lungs and your intestines, your inner ears. Mostly the hollow organs are the ones that are most susceptible to the pressure wave. And this too is where you can see some of the flash burns and stuff like that. The next one we're going to talk about here, or actually I forgot about this question here. Let's see, it says, what organ causes the greatest mortality and morbidity rate when injured by a blast? And that would be your lungs. Now, the next one we're talking about is your secondary blast injury. Your secondary blast injury does damage to the body, which results from being struck by flying debris, like shrapnel, from different devices, or from glass or splinters that can be set in motion from the explosion, objects that are propelled by the force of the blast, and the strike, any kind of strike to the victim that causes injury to the victim. The objects that travel great distances can be propelled at like really high rates of speed. Some of them can get up nearly to 3,000 miles per hour for conventional military explosives. That's where you can see a lot of people be getting hit by like the shrapnel and different stuff like that. That's what this picture is here. The third one we're going to talk about is tertiary blast injuries. And the tertiary blast injuries are the injuries that occur when a patient is hurled by the force of the explosion against a stationary object. More like that's where you hear like the blast wind. It also causes the patient's body to be hurled or thrown to the ground or against something, or it can cause further injury. It causes physical displacement of the body, and it's also referred to as ground shock when the body impacts the ground. In some cases, wind injuries are the ones that can amputate limbs. What kind of organs are susceptible to pressure wave? And that would be your hollow organs. Now we're going to talk about miscellaneous blast injuries. These are the injuries that include like burns from hot gases or fires that are started from the blast. You can get respiratory injuries from inhaling toxic gases. Let's see, other stuff like crush injuries from a collapse of buildings, among multiple other things. This is kind of all the other things that happen on top of the other 3 blast injury types. Most patients who survive an explosion will have some combination of all 4 types of these injuries, and these injuries are the ones that are most easily overlooked. Here's a little diagram here I found that's got a picture of 3 of the blast injuries. You can see the primary blast injuries over here on the right, and then the second part here in the middle, you'll see a secondary blast injury, and then on the left here is where it shows you where the tertiary blast injury would be taking place. Next, we're going to talk about the tissues at risk. These are like the organs that contain air, such as your middle ear, your lung, your GI tract. They're the ones that are the most susceptible to injury. Your ear is the organ system that is most sensitive to the blast injuries. Your tympanic membrane is detect minor changes in pressure and will rupture at pressures up to 5 to 7 pounds per square inch above atmospheric pressure. The tympanic membranes are a sensitive indicator that you can use to help determine the possible presence of other blast injuries. Patients may report ringing of the ears after a blast injury, pain in the ears, or some loss of hearing. Blood may be visible in the ear canal or dislocation of a structural component of the ear. There's lots of different things that the ear is very sensitive to, and this is one of the most main ones. And the biggest thing is they may get permanent hearing loss. At what pressure can the tympanic membrane rupture? 5 to 7 pounds per square inch above atmospheric pressure. Next, we're going to talk about pulmonary blast injuries. These are mostly defined as like pulmonary trauma, which is like consisting of contusions and hemorrhages that can result from short-range exposure to the detonation of explosives. When the explosives occur in an open space, the patient's side that was towards the explosion is usually injured, but the injury can be bilateral when the victim is located in a confined space. The patient may complain of tightness or pain in the chest. They may cough up blood. They'll have a little tachypnea or other signs of respiratory distress. Some cutaneous emphysema is a major one too that you can see, and that'll be detected over the chest through the use of palpation, indicating obviously air in the thorax. Another thing you could see is some pneumothorax, and then that obviously would require some decompression in the field by medics. Pulmonary edema may also ensue rapidly. If you expect any lung injury in a blast victim, you just got to administer oxygen. Even just the presence of a ruptured eardrum, they want you to administer oxygen. You can't give oxygen under too high of a pressure because it will increase the damage to the lungs if there is some, or it could cause damage. Just be cautious with IV fluids, which may be poorly tolerated in patients with this type of lung issue or injury, and then it could also result in pulmonary edema. Now we're going to go on to arterial air embolism. That's one of the most concerning pulmonary blast injuries that they're aware of or they're worried about. This can occur on alveolar disruption or air embolism into the pulmonary vasculature. Small air bubbles can enter the coronary artery and cause myocardial injury. The air embolism to the cardiovascular system can produce disturbances in their vision. It can change their behavior. You'll see the state of their consciousness be different, and there's multiple variety of different things neurologically that they will show signs and symptoms of. Neurologic injuries and head trauma are the most common causes of death in blast injuries. Concussion, intracerebral bleeding, or air embolism may occur. Bradycardia and hypotension are very common after an intense pressure wave from an explosion. Also, your extremity injuries, including like the traumatic amputations, are very common with this. Other injuries are also often associated with the tertiary blast. Patients with traumatic amputations by the post-blast winds are likely to mostly sustain fatal injuries from that blast. Even if patients were wearing body armor and survived the blast, injuries from the shrapnel wounds to their torso may still have an effect. Either it can kill them or it'll have severe orthopedic and extremity injuries. Let's talk about multi-system trauma. The multi-system trauma would more be described as the condition of a person who has been subjected to multiple traumatic injuries involving more than one body system, such as like your head and spinal trauma, or your chest and abdominal trauma, or chest and multiple extremity traumas. With this, you must recognize that the patients that fit into this category or this classification, and we have to provide rapid treatment and transportation, alert medical control as to their nature of the patient's injuries so that the trauma center is prepared for our arrival. The multi-system trauma patients have a high level of morbidity and mortality as well. Therefore, they do need to know ahead of time that they're coming so they can reassure that the teams of physicians are on staff to treat their injuries. These may also include specialists like neurosurgeons, thoracic surgeons, orthopedic surgeons, stuff such as that. Let's talk a little bit now about the golden principle of pre-hospital trauma. This here is like our main priority in managing the multi-trauma system is to ensure our safety, the safety of our crew, and then the safety of our patient. We should, determine the need for additional personnel, that will need help, especially if it's something to do with blast injuries or mass casualty incident. And we need to make sure that we have our equipment, evaluate our mechanism of injury, identify and appropriately manage our life threats. After we can focus on that, we can focus on our patient care. We can begin by assessing the managing airway, ventilatory support, do high flow O2, obviously do C-spine, make sure they're stable, or for stabilization. We got to make sure we do our basic shock therapy, bleeding control, all of that. If the patient is profusely bleeding, then obviously that has to be taken care of first, because if we don't have sufficient perfusion to the organs and the tissues, we obviously won't be having a patient. So once these threats are all taken care of, we can do our ABCs, make sure they're corrected, place the patient on backboard, and transport immediately. If the patient has been trapped, consider the use of an extrication technique. Most patients with multi-system trauma, definitive care requires surgical intervention anyway. So therefore, if we are on scene too long, they probably won't make it. Therefore, the on-scene time should be limited to 10 minutes or less. That's where they refer to that whole platinum 10 minutes. We just should be on scene for 10 minutes or less. Then during our transport time, that's when we can get our sample history, contain the secondary assessment, mostly just care for our patient, and we can do the best we can during our transport time. We have to keep in mind that the patient has sustained a multi-system trauma, and in order in which we usually provide treatment care can be altered a little bit depending on what the patient may need. Now we're going to go on to our patient assessment. With this, I kind of touched on a little bit with our multi-system trauma. Yeah, but then with this, we can go on to assessing our patient. We need to identify our life-threatening illnesses and injuries as soon as possible. Obviously, that has proven to improve the patient's outcome if we can get that taken care of right away. We have to assess and triage and manage the patient, transport the patients with traumatic injuries first, to the most appropriate facility. So make sure that you get them to like a level 1 trauma center or level 2 trauma center, whichever they need to go to. The major components of the patient assessment include the following. Mostly is the scene size up, our primary assessment, our history taking, our secondary assessment, and our reassessment. So when we go into assessing our patient, we just want to do our trauma assessment that we learned in class. So just our rapid trauma assessment. Here's a picture of the sheet. And a little bit of a review here. We have gone over blast injuries, the 4 different mechanisms of blast injuries, tissues at risk, our pulmonary blast injuries, arterial air embolism, multi-system trauma, the golden principles of pre-hospital trauma care, and the patient assessment.